Hi, welcome to my Population Health Management series. I'm Siva Chandrasekaran, your Population Health Intelligence consultant with over 20 years of experience across NHS and local authority organizations. Correct. Last week, we had a look at what is population health management, why it's important, and we reviewed the population health management cycle. This week, we are going to look at the first topic of population health management process, which is called segmentation. So, what is segmentation and why it's important? Segmentation is a process of grouping the population into smaller subgroups. Why do we need to segment? Why does it matter? In order to have targeted interventions, you need to understand your population. Then only you can identify, you can risk stratify, which means you can group people into high, medium, and low risk categories. And you can plan interventions. You can evaluate your interventions. So, why segmentation matters? Why do you need to group the population into subcategories? How can you categorize them? You can categorize people based on their need, their demographic makeup of the population, and the way they utilize the services. Why does it matter to segment the population? Say, for instance, if you know number of times patients attend a GP practice for appointments, if you know number of A&E attendances in hospitals, if you know number of admissions, do you think you can understand the needs of the population? You can understand the burden and the volume of it, but it doesn't tell you the need of the population. If I tell you that if you know how many people coming from the most deprived areas access the services, if I tell you how many people from ethnic minorities or white population accessing cancer services, diabetes services, mental health services, that can tell you something, right? So, hence, that's the reason why we segment, so we can understand the variation between these groups so that you can plan your interventions and you can plan the health outcomes and the benefits the individuals get through those interventions. And you can evaluate them and you can get feedback from them. Hence, we do the segmentation. So, stay tuned. In the upcoming videos, we are going to dive into more about segmentation, risk stratification, impact assessment, and evaluation. Remember, be happy, stay healthy. Please subscribe, comment, like, and share, and have a great day. Thank you.